Bismillahirrahmanirrahim. Hello everybody. So this is the question number 27, the part 2 of the question number 27, as we already solved the part 1 of the question number 27, and with the patient, 40-year-old patient having the postpartum hemorrhage. So in this question they are asking about that on bimanual massage of the uterus is performed and two large bore intravenous lines are placed due to ongoing bleeding. The patient blood pressure is 100 by 60 mm of Hg and pulse is 112 per minute and respiration are 18 per minute. Which of the following is the most appropriate next step and management of this patient? So, dilation and curettage, hysterectomy, infusion of oxytocin, injection of carboprost, and injection of methyl argonovine. So, first of all, in previous question, the patient diagnosis is postpartum hemorrhage. So what is the management of postpartum hemorrhage? So the management option and the choice below here, the choice C is the correct one, infusion of oxytocin. Because the management of postpartum hemorrhage begins with assessment of vital signs, intravenous fluid to maintain systolic blood pressure, and often transfusion of appropriate blood products. Treatment also begins with bimanual massage and uterotonic medication. Bimanual massage involves one hand massaging the uterus fundus abdominally and the other hand compressing and massaging the uterus vaginally. The first line uterotonic is oxytocin, which is generally administered via intravenous infusion. So here the correct option is choice C, infusion of oxytocin. Because this patient having postpartum hemorrhage and the most common cause of postpartum hemorrhage is uterine atony, and here the correct option is choice C, infusion of oxytocin. Come to the incorrect one, dilation and curettage. A. So a retained placenta necessitates dilation and curettage for removal. Choice B, hysterectomy. So hysterectomy is method of last resort but should not be delayed in unstable patient with massive hemorrhage to prevent death. Choice D, injection of carboprost. So carboprost is a synthetic prostaglandin that stimulates uterine contraction. Carboprost causes bronchoconstriction and asthma. And asthma is a contraindication to its use in this patient, as we already know from the 27 question that this patient is suffering from asthma. Choice E, injection of methyllargonovine. So methyllargonovine is a uterotonic drug that causes smooth muscle contraction, uterine contraction, and vasoconstriction. Because vasoconstriction can cause hypertension, and a history of hypertension is a contraindication to methyllargonovine, as we can see this patient is suffering from hypertension. So here the correct option is choice C, infusion of oxytocin, because this patient having postpartum hemorrhage and the most common cause of postpartum hemorrhage is uterine